Good afternoon. I am Dr. Carolyn Booker, ADEA Senior Vice President for Educational Pathways. We are delighted you have decided to join us today for our webinar, From Applicant to Practitioner. Given the current healthcare landscape and the national healthcare pandemic, the need for healthcare providers is more critical than ever, and ADEA is committed to helping you, the future practitioner, to achieve your dream of becoming a dental professional. Today, we have Dr. Judith Porter from the University of Maryland School of Dentistry, who will share 10 tips that will help you present your best ADEA ASAS applications. Dr. Dima Gunam and Michelle Thompson, our two dental practitioners, will share their personal journeys with you also, highlighting how some of the tips you will learn today will help you reach your goals. Again, thank you for being here. We hope you enjoy our webinar. And as we go throughout this, don't forget, submit your questions. Thank you.
Thanks, Carolyn. That's a great introduction. So my name is not listed here, but it is not a ADEA webinar, but Elizabeth Johnson, and I'm the Director of Recruitment for ADEA Application Services, and I will be the facilitator for today's webinar. So just a couple of housekeeping items before we get started. First off, all attendees are in listen-only mode. Secondly, this webinar is being recorded, so if you know friends who weren't able to join today, please be sure to share the webinar when you receive it in your email in a couple of days. And finally, and very importantly, ask questions. We're going to have a dedicated Q&A session at the end after all of our presenters have spoken. So we'll have about 15 minutes. So please send in your questions using the Q&A box, or feel free to wait till the end to use the Q&A box to send them in. So without further ado, Dr. Porter, you're up.
Hi, everybody. I'm Judy Porter. I'm from the University of Maryland School of Dentistry. And we're going to go over several tips for thinking about applying to dental school. So we're going to go to the first slide. Attitude, attitude, attitude. One of the most important things is being courteous and professional when you're interacting with anyone from admissions from any school. You may be getting frustrated because you didn't see something on the website, but be very courteous, because these are the people that you need to be friends with. And you don't know how it's going to have an impact on your application. The next tip is quality over quantity. Think of the two organizations that you spent the most time in. You don't have to list every single organization or group of people that you have spent time with in your college career. But think of the ones that had the most impact on you. Think of the ones that you believe gave you the biggest chance to understand what people are like, how to be a better communicator. When you're writing your personal statement, this is extremely important that you make this about you, that it's about you personally. Yeah, let's go to the next slide, because I kind of slipped into tip 3, talking about your personal statement and making it your own. When you're writing a personal statement, this is your opportunity to talk to people that have no idea who you are. You've had your own special journey, not only what makes you unique, but why did you even think about dentistry? Why do you think dentistry is a good profession for you? What personal journey have you had that caused you to think that dentistry is a way for you to have a positive impact on people? We read a lot of personal statements that say, oh, when I had my teeth straightened, that was a great impact on my life. So I wanted to become an orthodontist too. But is that the only reason? Are there other reasons that you could pull in that can convey to people that this is really what you want to do? This is how you feel that you will be serving the public best. So tip number 4, if there have been gaps in your timeline, explain those. Taking a gap year is not a bad thing. In fact, I think most of us kind of respect someone for deciding, you know, I want to take another year to get my act together. Maybe you've had a job and you've been saving to support yourself while you're in dental school. We just need to know what you've been doing for the past year. And most often, we like to see that somebody has in some way remained academically active. So tip number 5, we as admissions staff, admissions team, want to see your real passion, your real personality. We want to get to know you, not only in your application, but in the interview process. Please don't tell us what you think we want to hear. We want to hear your opinions. What makes you tick? What do you value really outside of dentistry? Tip number 6 is coming up. Be conscious of your body language. We were just talking about this in our admissions team meeting this morning. Practice with a couple of people. Do some practice interviews so that you're not fidgeting, so that you don't give all the answers to all the questions in the first 5 minutes because you read what the questions were on Student Doctor Network. So you know what we're going to ask, and you just say them all at once. Give the interviewers a chance to ask the question. Portray your real person, your real personality. Do you have a passion for dentistry? And I can't tell you the number of times the interview teams have come back to do their wrap-up sessions with me at the end of the day, and they will say, I don't think this person has a real passion for dentistry. I think their family really wanted them to go into dentistry. Or they say they've done all these hours of shadowing, but they really don't know anything about the profession. So think about that. Think about being genuine, about being personable. And tip number 7, don't shy away from including your hobbies. Some of the fun things you do on the side. Like I said before, we want to get to know you. Someone whose passion is model building, or the person that comes in and says, you know, it really relaxes me to knit. I do a lot of knitting. Or someone else might be a member of a band. We like to see the things that you're passionate about and the things that make you you. And this is what makes you stand out from the rest of the applicants, the rest of the 2,000 or 3,000 applicants that you are competing with. So tip number 8, be mindful of the visual picture you're creating. Ensure that your social media pages are void of inappropriate content and images. You look at our social media pages, we look at yours. We may even hear, wow, you should see what this person talks about on social media. Don't forget, we're looking for compassionate caregivers. We are looking for people who are going to be empathetic, good communicators, wholesome people. So tip number 9, have several people read your personal statement. This is one of the most important things that you can do. So we read through your application, we look at your GPA, DAT scores, what kinds of things that you've been doing in the past 4 years, and your personal statement. I read a personal statement once that said, I've always wanted to go to pharmacy school because my pharmacist and I had a great relationship. Well, this isn't pharmacy school. Somebody didn't proof that letter before you sent it to a dental school. Poor grammar. Maybe you've written something you were really passionate about, but you wrote it so quickly that it doesn't come out well on paper. Have 2 or 3 people read it for you to make sure that it's clear, that it's concise, that's you give someone else the opportunity to say, is this what you were trying to say? Is this what you meant by this phrase? And give you an opportunity to say, I wonder if that was exactly what I wanted to say. We want to hear why you want to be a dentist. What's important about the profession, what's going to be fun for you about the profession. So tip number 10, bring your A game. We're building classes. There are lots of different ways to be competitive and a standout applicant. Your personality is the biggest thing. How you interact with people, how well you communicate. More than anything else, dentistry needs good communicators. We all spend a lot of time texting now and emailing, which means that we are not in direct face-to-face, eye-to-eye contact with a lot of people as much as we were before. You will be in dentistry. If you've been observing in the dental field, pay attention to the patient's position and where the dentist is. You're going to be about 17 inches from someone's face. So you have to be a good enough communicator to develop a relationship with all of your patients. We want to see that you are able to develop a relationship with us when we're interviewing you. So those are the 10 tips. You're going to hear from a couple of wonderful people about how their journey was from undergraduate through dental school. And we're going to be looking forward to your questions that you're typing in.
Thank you so much, Dr. Porter. Fascinating stuff, and I hope everyone was taking notes. So now our 2 distinguished guests will share their journey about becoming a dentist and discuss some of how the tips that you just heard from Dr. Porter help them become successful. So remember, we will have some time for Q&A after this, so please have your questions ready or use that handy Q&A box to send them in now, and we'll get them organized and ready to go after our 2 dentists have spoken. So Drs. Gunaim and Thompson, thank you so much for being here. Dr. Gunaim, please get us started. Brief introduction and then your story. Thanks.
Sure. Hello, everybody. My name is Dr. Seema Ghanem. I am a graduate from the University of Maryland. I'm a maxillofacial prosthodontist. My training and my specialty is to take care of head and neck cancer patients. My journey started when in my undergrad years, where I knew I had a huge passion for science. I loved working with my hands and just building stuff. And I wanted to find a way to join and marry both of them. And that's when I realized that dentistry would be a profession that allows me to enjoy the science, but also have a um, hands-on profession that helps me change people's lives. When I went into dentistry, I didn't know much about it. I shadowed, of course, a dentist. When I first decided that I wanted to apply to dental school, I actually went to the dental school at Maryland and met with somebody in the admissions office and figured out what is it that a dental school looks for. Then I studied for the DATs, got all of my paperwork together, and now that I sit and I listen to what Dr. Porter said, I kind of, without having those 10 tips, it was really what I followed. I made sure that my letter, I had multiple of my family and my faculty read it and got input to make sure that I am getting across my point and my passion. I didn't mention another field that I wanted and didn't work, so I decided to do dentistry. It was really the goal of the marriage of science and a technical skill that made me want to become a dentist. Coming into the interview, I made sure that I practiced with somebody prior to my day of the interview. And then day by day, as I got into dental school, it kind of helped me mold my interest. As I said, I was somebody who didn't know specifics. So for example, like what Dr. Porter just said, I had orthodontics, so I saw what my orthodontist did, so I wanted to become an orthodontist. I didn't have that bias coming into dental school. I just knew that I loved the field. I loved the intimacy that a dentist and a patient has. Your patients do become your family. And from that, I realized that I really loved prosthodontics, which is the more advanced full mouth reconstruction. I know if you see now on TV a lot of commercials about implants and teeth in a day, that's kind of the path that a prosthodontist takes. And as I got my training also at Maryland, I started caring for cancer patients. And that's when I found my true passion, which is reconstructing cancer patients. That took me to another round of applications, which was when I applied for a fellowship afterwards. So I did the 4 years of dental, 3 years of residency, all at Maryland, and then I did a year fellowship at Memorial Sloan Kettering. That year of fellowship helped me train to see the medical portion. We focus a lot on the dentistry, and we do learn the treating the patient as a whole, but you really don't grasp it until you are treating patients in a medical setting like in a hospital. So I got exposed to caring for all cancer patients. And that became my true passion. And I went back and now I work full-time at the University of Maryland, where I care and reconstruct cancer patients. I teach the future dental generations, our future dentists, in caring for cancer patients for pre-radiation and their pre-surgicals and even for reconstruction afterwards. And again, as I think and reflect on my journey, and I remember what Dr. Porter was saying, the key to success is being genuine, is showing your true self and your true interest. Dentistry, you will get a lot of interaction with your patients, and your patients are going to put their trust in you. So you have to be genuinely interested in caring for them. Caring providers are the most important they're the successful providers. Each patient that you see is going to be your mother or your sister or your husband or your brother or your grandparent or your father. So treating them that way will give you the key to success. And when you go into interviewing and you go into talking to dental schools, showing them your genuine interest in helping people out and to having a profession that you know you can make a difference for those patients and that you can improve their quality of life. That's basically what's going to help you achieve your dream and get into dental school. Elizabeth, I'm not sure if we're getting any questions for me or if we're going to move to Dr. Thompson.
Yeah, I think thank you so much, Dr. Gunim. I think we're going to move to Dr. Thompson, and then we'll do some questions afterwards. So Dr. Thompson, you're up.
Okay. Well, hi, everybody. My name is Dr. Michelle Thompson. I am currently an assistant professor at the University of Texas at Houston School of Dentistry. I'm also the director of digital dentistry, so I can get into kind of how I got into that journey. But similar to Dr. Ganam, when I graduated, from college, I really, I knew 100% I wanted to get into dentistry, but getting to that point to applying and getting in was such a journey for me. I started at the University of Houston. I was a pre-dental student, and first thing I did was join a pre-dental organization. For me, that was a huge stepping stone to really learning about dentistry. I didn't go into college knowing that I wanted to be a dentist, so being part of that organization really opened my eyes to learn about dentistry in general, and then I got to volunteer and actually see it firsthand. One of the things Dr. Porter talked to you guys about was, bringing your A game, making sure that, you stand out also in terms of being an applicant. And so being part of organized dentistry, being part of an organization can make you stand out, because there's only one you. And when you're applying, they're looking at, your personal statement on paper. So you're not right in front of them to tell them about you. So it's important that you include all that information. When I was in college, I got involved in the organization, and I started, getting into different leadership positions, and actually even became president of my pre-dental society. All of these things are great, but at the end of the day, you still got to have the grades. And I think that's something that, going back, every time when I go and talk to students, I tell them it's good to be really involved in a lot of different activities, but narrowing down your focus to the ones you're most passionate about so that you can focus on your academics is going to be key. I actually went to dental school out of state, so I'm from Houston. I decided to go out of state because I felt like I wanted an opportunity to just kind of discover myself and grow up and, be away from home. So I went to dental school at Howard University College of Dentistry in DC. So I'm a proud Howard alum. And I will tell you, it was the best experience of my life. I learned so much about myself. I learned so much about dentistry. I learned so much about leadership, and I took everything that I learned in college, everything in terms of the leadership, all the coursework, everything, and took it with me, and I was able to, get through dental school and do really well. I was blessed because I had a lot of mentors. I had a lot of friends that really supported me throughout my whole journey. Making sure that you stay in contact with these people from the beginning. So your college mentors that you have now, they're going to be part of your life and your journey, as you get into dentistry, and having them as a support was huge for me. While I was in dental school, I wasn't really sure what, type of dentist I wanted to be. And that's okay, because you have time to figure that out. All I knew was that I had an interest in helping maybe some of the population that really just don't have a lot of access to care. And in my case, I was talking more about like patients that are either like a special needs or have any kind of medical issue that they couldn't go to the regular dentist. I wanted to be that person that could treat them. So I decided to apply for a program when I graduated dental school, and I did a residency program where I learned about hospital dentistry. I learned how to treat patients with all sorts of disabilities, and that was such an amazing opportunity because I use that in my practice now every day. While I was in dental school, I also was involved again in organized dentistry. So what I did in college, I took with me, and I continued on my journey in dental school. I was involved in my class leadership. And worked my way up eventually to student council president when I was in dental school. So I think it's important that if you're passionate about it and this is something you like to do, to continue that. But at the same time, like I said earlier, you do want to focus and make sure that you do what you need to do in terms of your grades. I know that always comes up, but it's very important. And of course, when you're applying, to apply early, and that's going to be a huge benefit. Now, when I graduated dental school, I did my residency program here in Houston, and I had this burning desire to teach, and it didn't come until I had an opportunity to actually teach 3rd and 4th year dental students while I was a resident. And I enjoyed it. And I said, hey, you know, one day I think I want to go into academia. And one thing people don't realize with dentistry is there's so many opportunities. And, you know, private practice is one model, but there's so many other areas of dentistry that you can get into, and academia is one. And when I graduated from my residency, I decided to be a part-time faculty so that I could still practice outside 4 days a week. And then I went to the dental school 1 day a week, and I loved it. For the past year, this is completely new for me, I transitioned into academia full-time. I'm passionate about teaching, and I'm at the point in my career where now that I've pretty much figured out what I love to do the most, I found myself the perfect position to teach what I love to do, which is digital dentistry. Digital dentistry is basically any type of dentistry that can be created or fabricated digitally. What I mean is, like, you can have somebody come into your office and let's say their tooth broke, and you can actually use a computer and design a new crown for them on the computer and make them this crown the same day. Same thing with dentures, that sort of thing, and designing it. And you guys have heard a lot about 3D printing, all of that. So that's pretty much what I focus on now. But if I were to go back and thinking about my whole journey of how I got to where I am today, I think that the biggest thing for me is just to make sure when you apply that you show who you are, and not just who you are in terms of listing your activities, but who you are as a person. Because at the end of the day, you are one of thousands of people that apply for all of these schools. And the only way that you'll be able to stand out is by showing who you are as a person. So I think that's very important to remember. In your personal statement, one thing that I tell a lot of my mentees now is I tell them, read every paragraph and ask yourself, what does this say about me? And if it's so broad or so general, that's something that you're gonna have to go back and edit. And I think when I did my personal statement, I showed it to about 4 people. I probably went through about 20 drafts before I got to my final version, and that's okay. But you know, it got better and better, because really that's your story until you go in person and have an interview. If you get to the point where you have an interview, then you know everything else about you, you know, your attitude, the way you carry yourself, all of that they'll see. But on paper, they don't see any of that. They just see what's written on paper. But pretty much that's where I am today. And, you know, I think dentistry is probably one of the best fields to get into. You have time for a family, time for a life. I have a 2.5-year-old boy, and, you know, very happy with this career and the stability. So that's pretty much it for me.
Great, thank you so much, Dr. Thompson. So given our current situation, this kind of unexpected pandemic that we've all been facing, and the reason that we're kind of doing this webinar in a virtual environment and not in person is COVID-19. And actually, you know, I think, you know, we don't hear a lot about what dentists are doing. You know, we hear a lot about medical doctors and hospitals and nurses when they're all doing fantastic work. We don't hear a lot about maybe what dentists are doing, and we do have a kind of a unique opportunity here. Dr. Gunaim is actually doing some work, you know, in the hospital for COVID-19. So she said she'd be willing to kind of deviate from our script a little and talk a little bit about kind of what she's doing. So I'm going to hand the floor back to you for a couple of minutes. If you wouldn't mind talking, that'd be great. Thanks.
Sure. So it's definitely, we're practicing in a different time. We are no longer doing any of our elective care. Being a maxillofacial prosthetist, I care for cancer patients. So all of their care is an emergent need. So we cannot defer their surgeries. So we are still functioning to do those. But what our biggest support to the hospitals have been is that our oral surgery clinic still runs. So all those patients that would go to the emergency room due to facial swelling or pain or trauma. Instead of doing that, they are actually coming in, and I am part of 10 faculty that in the oral surgery department that sees them to try and reduce our exposure. We are assigned dates, and we come in, and all we do is triage and take care of patients that are having swelling, pain, any trauma, just to help and offload the emergency room across the street in the hospital. So that is something that's different, where a lot of the times that we would approach things in a more conservative way of trying to save teeth, we're reverting back to having to take out some more teeth than we would like to, but just because the risk of practicing dentistry the way that we're taught increases our risk of spreading the virus. As you well know, we work in the mouth, and this is a respiratory virus that can be easily spread with our suctions, with our hand pieces, with the motors that we use. So we can't use any of this. We have to be very careful. We have to do our extractions without all our toys and gadgets that we're used to having. But the most important is to offload our hospitals. And even in the grand scheme of how patients are taken care of, and at the University of Maryland, should there be a huge surge that the medical physicians are overwhelmed, the dentists in the school that are hospital credentialed, which are basically the faculty that are part of the oral surgery and pediatrics clinics, we would be their backup to go and help them out. So even though, yes, we are in the dental field, being part of a great institution as I'm lucky to be part of, we can actually help out, and we can, by either offsetting their ERs, or if they need us to go in and help care for those patients, we can do that for them too.
Great, thank you so much. I know that wasn't kind of part of the script, but
yeah, but it's interesting, and it kind of shows that you go into dentistry thinking to do one thing, and then once you do get into dentistry, it's one of those professions where there is no limit to what you can do. I went in thinking that I went in not knowing much and thinking just doing the conventional dentistry, which I love, is all I want to do. But then as I got exposed to different specialties and different aspects of it, it kind of sparked my interest, and I started doing more and more. And as I said, it started with, I did dentistry at the University of Maryland, then I did the postgraduate 3 years for prosthodontics, which helps me do those full mouth reconstructions and then all of these bigger cases. But then going into maxillofacial prosthetics, I'm able to make eyes and ears and other prostheses that other people would say, wait, what? A dentist makes them? Yes, yeah. Because the materials that we use to make these prosthetics are the dental materials that we use to make dentures and crowns and all of that. So I feel like this is one profession that's limitless in what you can do with it.
Absolutely. Thank you. And I think even Dr. Thompson's, discussion about digital dentistry, I know we'll have a couple of questions in the Q&A box about, what that looks like and what the future is. I think that is the future. So we'll talk a little bit more about that in a second, I'm sure. But I just want to say thank you to all three of our panelists. So our Dr. Ghunem and Dr. Thompson for talking about your journey. And then obviously Dr. Porter for giving us the 10 tips that I hope, as I said earlier, people fervently were writing down and taking to heart. This is a trying time, and I'm so thankful that we, have the technology in place to be able to do something like this and be able to share these wonderful stories and tips with everyone who's in attendance today. So thank you. We've reached our Q&A session, so let me just jump in. We have a million questions, as I expected, and I apologize in advance if we can't get to all of them. I know we won't be able to, so I will do my best to get to as many as I can. One that came in actually, which I think is a great question, is for Dr. Ghunem. It's, as a pre-dental student, can we be doing anything differently than the general public during the pandemic? I thought that was a fantastic question. And the answer might be no, but it's good to ask it.
At this point, just staying at home, practicing social distancing, and taking care of yourself and your family is the best that you can do. listening to our physicians and those at the front line is going to be the best way that you can contribute. Don't add to the problem, but really follow what they're telling us. It is something, it's a new beast we don't know much about, that we're trying to kind of manage, and following what the medical professionals and those at the front lines are telling us are going to be the best thing that you can do.
Yep, absolutely.
Well, another thing that they can be doing is practicing hand skills. This is the perfect time for you to be developing dexterity. When the question about dexterity is asked, we hear so much from students like, oh yeah, I play golf, I'm a captain of the baseball team. That's eye-hand coordination.
Mm-hmm.
Dexterity is manipulating tiny things like model building and knitting. Knitting keeps me sane right now.
Make some masks.
Sanity.
Yes, absolutely.
They could also be working on their application. This is probably a good time to get that together.
Coming up to that time, so yes, stay busy. And yeah, I mean, as Dr. Porter mentioned, you want to take your time, have people read it a few times, and this is a good chance to do that. Thank you very much. Another question that came in, and this is probably for Dr. Porter really, is should you include all of your shadowing experience or just really focus on quality versus quantity?
We're going to ask you how many, I don't know how that happened there.
That's okay.
We're going to be asking you how many hours you have shadowed. I don't think the application has room for you to put all of them down. Maybe your two most important experiences shadowing. And then we're going to wonder during the interview if you learned anything from that.
Great. So another question in the box, how do you, and this is to either of our it could be all three of you actually, you're all dentists. How do you handle dental burnout? I think this is a question that we get all of the time, at least on the webinars that I conduct in some form or another. You know, how do you handle that? And I especially think that's relevant for Dr. Ghunem now, given that you're actively working during the pandemic in a hospital setting. So all three of you, please, I think you all have three different angles and it would be very interesting to hear it. So Dr. Ghunem, why don't we start with you?
I think the key to this is finding a balance to make sure that when you're working hard, but you always make time for yourself, kind of your sanity and what helps you kind of manage your stress. As Dr. Porter said, you know, having a hobby or something that you like to do. She just said that knitting is keeping her sane right now, and I love crocheting. It doesn't have to be that, but every dentist that I know has some passion outside of dentistry that they continue to keep up with, that takes away from the stress of it, because dentistry does become stressful. It's a job where you're always working, so you're not, you know, there isn't a time when you're not going to be interacting with patients, so it does physically and mentally overload you. But if you find something that kind of, first, having good time management so that when you're working, and then you have dedicated time for yourself and your family, and having a passion outside of it, something that you enjoy doing.
Yep, great. Dr. Thompson?
Yeah, so piggybacking off of what Dr. Ghunem said, I mean, finding that time for you is going to be key to anything, you know, related to stress. For me, I have what we call mommy time, and then we have baby and me time. So when I'm at work, you know, obviously, you know, I'm 100% focused on my patients, doing everything I need to do. When I'm teaching, same thing to my students. But when I go home, the one rule in my house is we're not going to talk about dentistry all night. And my husband's an endodontist, so we don't talk about root canal all night. You know? So when we go home, we take our time to just enjoy. And you know, having a 2-year-old and, you know, wanting to watch him grow and be part of his life, you know, most of my time right now is all baby and me time, but I will say I always find a point in my week that's me time. And this might not be their hobby, but mine's probably a lot of television, Netflix, movies, things like that. You know, when my son is asleep, I have those couple of hours that are just for me. Nobody bothers me. I have the couch, the TV, and myself. And that's a huge, you know, reliever of stress for me. And then I love to listen to music. Music is just one of my passions, and cooking as well. So those are kind of my three things. But outside of that, it's really just being a mommy and enjoying life and not talking about dentistry when I'm not, you know, in the dental office or at work. So
We can all appreciate that, right? Not talking about work all the time. So very good. And Dr. Porter, how about you?
I've had a little bit more time to work on this. I'm older, can you tell? Dr. Ghanem is my dentist. What?
I was your student too.
Your brain needs to slip into neutral at least once a day.
Yeah.
We've been talking about some creative things to do. Ways, when you think about it, when you know about some neurology, a way for your mind to slip away from math, science to the other side of your brain, where you can play a little bit, where you can be creative, where you can slip into the story of something on Netflix. And achieving balance, like Dr. Ghanem said, is so important. Don't give up the things that you've already developed a passion for. You need family time. I have a 5-year-old grandson that I read to on Messenger at night. We need to spend time with the people that are important to us.
Thank you. And I think that's obviously more relevant than ever given the current situation, and finding creative ways to do that has been very interesting, certainly in my own life too. So thank you. Kind of given the current situation, COVID-19, one question, and I think this is more for Dr. Porter, is, you know, what's your recommendation in your personal statement to talk about the challenges that COVID-19 have brought, you know, in their journey to becoming a dental student? Is that something you should address in the personal statement?
You can address that in the personal statement, but what I'd rather hear is what you've learned about yourself during these challenges. What kinds of creative things have you learned that have helped you get through this? You know, we are in bizarre times. I was just telling someone today that it's kind of hard for me to wrap my little pea brain around the fact that it's not just here. The earth, the globe is doing this. And what have you learned from it? I've learned how important my friendships are, my family. I hate talking on the phone, but I've been doing it because other people need it. People are baking bread. People are baking. People are making soup. People are learning or getting back to skills that maybe that people in World War II were doing. You know, you place an order at the store, you might not get it all. So I do want to hear something about the challenges, but I want to hear how you have managed the challenges in creative ways.
Great, thank you. Another question, of course, kind of around COVID-19, not surprising. And so we already kind of briefly touched upon this, but, you know, obviously, you know, with shadowing not an option right now, and this is probably for, you know, applicants who are thinking about applying in the next cycle, not the upcoming cycle, but what are some of the other things they could be doing outside of, we talked about manual dexterity, so are there other things that prospective applicants could be doing just to make sure they're kind of keeping up with dentistry, in a time where you can't have that, in the office shadowing experience? I mean, this is open to anybody. Dr. Porter, probably it makes sense for you to at least be the first person to answer the question, if you have any thoughts on it.
I think I'd do some reading. Read some research, some dental research on PubMed or Google Scholar about digital dentistry, about some of the advances being made in dentistry, the things that we are learning about how oral conditions can affect the whole body. Broaden your horizons a little bit. Take this to be a time of learning.
Great. Any other comments from the other two panelists? Or
I agree with Dr. Porter, just kind of immersing yourself and trying to see more about dentistry and what's, Dr. Porter's correct. Digital dentistry is the big thing now for us, and its effect with implant placement and even facial prosthetics. It's the big thing, and you'll be able to find a lot about that.
And the other thing I just want to mention is, like, if you have a dentist mentor, with the times being a little slow, this is probably a good time to have like these virtual conferences, talk to them about
great idea.
dentistry in general, and then maybe some advice for applying, because a lot of us are at home right now that are not on the front lines. And so this is a good time to reach out to your mentor, and take that time and do it.
that's a fabulous idea, Dr. Thompson. And certainly I'll plug ADEA, which I was going to plug later, but I'll plug now. We're trying to host, many virtual events now. We have a virtual event coming up on May 19th. I'll remind everyone again about that. So I think there are a lot of virtual opportunities, and, obviously dentistry related, you want to find those, but even going back to that work-life balance, find virtual opportunities that make you happy, period, whether it's meditation or learning a new language or taking a virtual cooking class. I mean, this is the time to do it. I mean, this is really an unprecedented opportunity to kind of do some of that stuff. So anyway, that's my personal plug. A nice segue, because we keep talking about it and it's not going away, nor should it go away, is digital dentistry. So Dr. Thompson, could you talk a little bit about kind of where, what kind of advances you think are on the horizon in the next, 5 to 7 years? So, most of the people on this, this webinar are about to, apply to dental school or are going to apply in the next cycle. So, they're a good 5 to 7 years away potentially from kind of being in the field. So, their landscape of dentistry is going to be very different than what it is right now. I mean, we don't even know what COVID-19 will do for the landscape, but, that aside, in general, digital dentistry is really kind of, forging ahead in terms of the field. So if you could go into kind of what's kind of on the horizon and what we think we might see in 5 to 7 years, that'd be great.
Sure, absolutely. So right now, like, I kind of have to give you a picture of where we are now. So in terms of digital dentistry, most of the dental labs that actually make a lot of these prostheses, restorations, majority of them do digital dentistry already. But when you look at the private practice dentist, they say only about 10 to 15% of them are actually doing digital dentistry themselves. And what that means is, having the technology in your office to be able to, help and start the process of designing these types of prostheses. So from where we are now to where we're trending, it seems that all the dental schools, number one, are starting to see, hey, we need to start introducing digital dentistry early, get students to start learning about it while they're in school. And so through ADEA, of course, we have like a CAD/CAM group, and basically there's groups of schools that are now starting to communicate a lot more, probably over the last 10 years, and really at the forefront of doing a lot more digital dentistry in the curriculum. At UT Houston and our dental students, from the first pretty much semester, when you walk into the school, digital dentistry is part of everything we do. We actually use digital dentistry as a way for you to evaluate your work. And what I mean by that is we have a camera that can go inside of the mouth that can actually take images or pictures of your tooth, and then you can see it on a screen. So what we do is that when you're learning on like a plastic tooth, we can actually scan that and evaluate and look at it on a screen and, you know, make corrections on our own work. So just in terms of learning, it's already in the process at a lot of schools. Now, as you start learning about digital dentistry, you start learning about all the different aspects of digital dentistry. So, you know, that's just one component, making crowns, making dentures. There's so many other areas too where people are actually, you know, taking images of a patient's entire head, including their skin, their face, everything, digitally, and you're able to create a brand new smile and design it digitally with their image. You know, we're also superimposing like a CT scan, and we're able to design an implant. So when, you know, Dr. Ganam was talking about all these prosthetics and things that she does, a lot of those can be designed on computer, and she can actually look at the computer and design a lot of those now, which is amazing where it's headed. So if I'm looking at 5 to 7 years, when you guys graduate, digital dentistry, I don't think at that point is going to be where 100% of offices are doing digital, but I think the percentage of offices doing it is going to increase, especially when you're trying to find your first job. There's going to be offices that say, hey, we do digital crowns in our office, or we do digital dentures. What is your experience? And, you know, you'd hate to be the person to say, well, I don't know anything related to it, and they give the job to somebody else. So that's part of the reason why a lot of the dental schools are really starting to introduce it early. The other part too is, you know, especially with the virus and everything going on, anything that you can do in your own office yourself, you'll have more control instead of sending things out. That's going to be huge. And I think digital is going to get bigger just because of that fact, where you can actually make a lot of things in your own office and eliminate having to send something out. That's one thing that I think with the virus, that's gonna increase, but also just in general, nowadays, what do people want? They want something fast. They want something right now. They want something that looks good, you know, and people are excited when they hear digital. So it's one of those things, if you can do it and you see a patient and get it to them, whatever you're making faster, they're going to be excited. They're going to want to do it, because that means less times they have to come back to your office, especially with the virus. They want to be able to just go in and go out. And that's a huge part of digital. And, you know, right now, like I said, we're kind of in the middle of the huge, you know, introduction of digital into all these dental schools. But in 5 to 7 years, it's going to be part of just everybody's curriculum. And I see that. And soon enough, they're going to start asking questions on your board exams and licensing exams. Digital is going to be just kind of what we do. It'll come natural to us eventually.
If we were to look back 8 years when we were dental students, digital dentistry was basically in the beginning of it. You know, I remember we had CAD CAM. We had one faculty that kind of taught us how to use it. We had very limited experience with it, but and it wasn't very commonplace. But right now you have multiple manufacturers, you have more schools that are teaching it. And the biggest reason why you find it more in schools but not in practice is the actual cost of those machines to run in dentistry, in dental offices. But by the time they go through their training, and we're talking about 7, 8, 9 years out, when they're in, you know, in 9 years. So I graduated dental in 2011, so I'm 9 years out. But if we look in 9 more years out, I'm pretty sure that cost is going to be down, which makes it more commonplace for you to have digital dentistry in the private practice too. So the more that the dental schools push and make that as part of the dental education, the more companies that we're going to have that actually build up and create those machines and softwares that make it easier to work with and make it more cost effective for dentists to be able to run their offices. Because I'll tell you, as a dental student, I had I had experience but little. When I went through my pros training, we had more exposure to digital dentistry, but it was really cumbersome. We had to put a lot of hours into it. And now I teach in the postgraduate clinic, and I see what my residents can do. And what used to take me 3-4 hours to plan for a surgery, now they can sit and like get it all done in 20 minutes. So in 10 years, that's going to be even easier and more facilitated.
It comes natural to them almost.
Yes.
Doesn't it? Kind of crazy.
Oh
You just show them one time and they get it, and that's
they
just
get
the
it.
generation.
They know exactly what to do.
But even the cost of everything is starting to go down already.
Absolutely.
So pretty soon, I think everyone's going to have at least a scanner in their office for sure.
I completely agree with you.
It'll be a very interesting time in 5 to 7 years. Maybe we'll reconvene this call and we'll have to talk about where things are now then versus now. So we only have a couple of minutes left. So I want to make sure, there's a million questions. I said I won't get to them all, and I'm sorry, but a couple of things I want to answer first. Two questions came in on the manual dexterity end. Does sewing and origami count? And the answer is yes.
Yeah.
Absolutely.
Sure.
Yes. So that's, I just want to quickly answer those. People are asking, are these slides going to be available? This presentation is going to be recorded and shared. So the slides are within the presentation. So that will be available after this. So you will have all that information at your disposal. We get this question again every time that I have a webinar, and it's about paying for dental school. People, and I get it. It's not the least inexpensive thing that you've ever done. Obviously, it's worth every penny. Do you, all of you, if you'd like, just kind of briefly talk about what, maybe offer 1 or 2 pieces of advice for, prospective applicants. So you haven't gotten to dental school yet. What can you do to kind of prepare yourself financially, if it's around the application, but even in the future, what can you do to prepare yourself? So Dr. Gunem, we'll start with you.
Sure. Dental education is definitely very it's a good investment, but it's definitely costly. I think one of the ways that you can reduce it is by trying to stay in state. That was definitely what I did. I'm a Marylander. I went to University of Maryland, Baltimore County, and then I applied to dental school at Maryland, and I stuck there, and I did my residency at Maryland to help reduce my loan burden. But even afterwards, there are programs that you can be part of to help you reduce your loans by either joining one of the practicing in one of the areas that doesn't have a lot of dentists, so that it's kind of like a public service loan forgiveness programs that will help you pay off this debt by working and serving the underserved areas, which I think kind of it's pretty rewarding in itself, and it helps a lot.
Dr. Thompson?
Yeah, so one big thing is when you're in dental school is really to watch, what you spend. And I think, especially because when you get your student loans, because everyone pretty much gets loans unless your parents can afford to pay for your dental education, the loans are going to be a lot. And sometimes, they give you so much money for your housing and all of that. If you don't need to use that money, then don't use it.
Okay.
You can accumulate, the better. And just like Dr. Gunan said, in-state's great, but if you have to go to private school or, obviously you want to go wherever you get accepted. But if you have the blessing to have been accepted to more than one school, then I would go with the cheaper school, just in general. Because no matter, where you go, you're going to, of course, we want you to stay in this country would be the best thing. So you can become a dentist here. But, cost is a big thing. And then also look at cost of living, when you're looking at locations. Can you afford to live in that part of, the country? Or, do you have plans? Also, if you have family that you're bringing with you, are you already married, have a child? Is someone going to be working? So if you have a spouse, maybe they can start help paying off some of your loans while you're in school. But it just kind of depends where you're at. And, right now I would say minimize, and save as much as you can on the side, because anything you can use towards living later is going to help you. Anything you don't have to take loans for would be great.
Absolutely. Dr. Porter, anything to add from your side?
I echo what Dr. Thompson said about being careful of spending. Don't use it if you don't have to use it. This is not a time to be taking vacations out of the country. And it's great to seek education at the least expensive school, but I think what's more important is to make sure that you choose a school that you think fits you.
And that's a lovely segue into what I'm going to plug. Well, first, let me just say thank you all very much for your time. I know it's kind of a hectic world we live in right now. So I appreciate you carving out some time today to talk to prospective applicants about your journey and obviously Dr. Porter about sharing the tips. So thank you very much. You know, we had some great questions. As I mentioned, we didn't get to all of them, so I apologize. And I want to give a shout out to Miss Shantae James in the background, who was sending me lots of questions and trying to filter through them the best she could. So thank you. And Dr. Booker, who had to leave us, thank you for that introduction. You'll see on the screen there the ADEA GoDental Virtual Fair. It's coming up May 19th. So, you know, we are having this webinar because our in-person event got canceled. So please, 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 you know, it's a free event. It's from 2 to 9 p.m. on the Tuesday the 19th. Dr. Porter will be there representing UMD, and there'll be over 60 dental schools. So I really encourage you to come for some or all of it. It's a really fabulous event, and you can ask some of those questions, especially the fit question. I mean, that's really what we're promoting at this event, is finding the right fit for you. Don't apply to a school that's not the right fit. I mean, money matters, of course, but you know, don't apply to a school you're not going to go to. You're spending 4 years there. It's like another college, you know, experience. So make sure you find the right fit across the board. So you have that chance to ask the schools those questions about their programs and find out what schools are right for you. So that is my plug. You can find out more information on adea.org/GDVF20. We also have a lot of other free events over the course of the year. So adea.org/GoDental. Thank you everyone for joining us. We'll have more events in the future. So please always reach out if you have questions. ADEA GoDental is a great resource and we always love to hear from you. Thank you again, everyone. Have a great day and take care.
Take care.
Bye.
Bye.